Hi, I'm Dr. Mark Philaday. I'm the Director of Functional Integrative Medicine here at the Amen Clinic. So one of my jobs is to figure out why mental health issues occur in patients that have abnormal brain scans that we do here. That's kind of our main gig, is looking at your brain, right, to find out what's going on instead of just guessing, as you know Dr. Amen always says. So I want to talk a little about Lyme disease, because this is one of the things that's really a hidden epidemic. Now, most people think, oh, Lyme disease, okay, well, you have to be in Maine and you have to have a tick bite and a rash, otherwise you don't have Lyme. And unfortunately, that's what a lot of doctors think as well. Well, I want to say that's just not the case. The CDC has even come out recently and said that we sort of made a mistake. It wasn't 30,000 cases a year, it's 300,000 cases a year. So it's very widespread. It's a very smart bug. It literally has 3 times more DNA than any other bacteria on the planet. It's very well adapted. It knows how to hide and kind of come to a truce with your body until something else can sort of release it. So Lyme disease, again, very widespread. It's in every state and it can cause virtually any problem you can imagine. It's well known to cause pain and fatigue. However, it can cause any neurologic symptom you can imagine. Literally anything in the book, the DSM book, can be caused by Lyme disease. Anxiety, brain fog, memory loss, depression, OCD. It's been linked to other diseases as well. So, Berkeley, California, UC Berkeley did a study. They found that 60% of the birds in Berkeley have Lyme disease. 30% of the ticks on the birds have Lyme. Stanford did a study in the San Francisco Bay Area. They found that 3% of the ticks in state parks have Lyme. And it also turns out that the kind most common in California, called Miyamotoi, doesn't even show up on regular Lyme tests. So you have to have a high index of suspicion, which I always do. Now, if you go to your regular doctor and ask for a Lyme test, you're going to get something called 2-tiered testing, where they do a straight up screen test. It's a lousy test. So if you've had suspicion you've had Lyme and you asked your doctor for a test and they said you don't have it, believe me, they haven't ruled it out yet. You have to do at least what's called a Western blot. So the bottom line is Lyme is really ubiquitous. You don't have to get it from a tick. Turns out any biting insect can carry Borrelia, which is what causes Lyme. They found Borrelia in mosquitoes. So could you get it from another insect bite? Yes, you could. Now, its life cycle is ticks, and most doctors will say you have to have a tick bite to get it. It's just not the case. So I've uncovered many cases of Lyme disease that were misdiagnosed as ADD, as dementia, as memory loss. So it's always on the radar. And again, very widespread. So have a high index of suspicion. So I always ask all my patients, have you ever had a tick bite? Well, yeah, you know, I did when I was a kid growing up in Kentucky, but I never got a rash. But now I have all this joint pain and I can't think straight and I have anxiety. So again, high index of suspicion and very widespread. Not to make everyone panic and think they have Lyme, because a lot of people go overboard and are convinced they have it and don't. So you really should see someone that knows what they're talking about when they're testing and treating you. So just a little FYI on something quite widespread and not well known.